Imagine that your body's energy regulation system abruptly collapses, resulting in a silent but potentially fatal situation. Imagine your car's fuel gauge dropping to empty in a matter of seconds, even though the tank should be full. This kind of condition isn't about having high blood sugar, rather, it's the exact opposite, a severe blood sugar collapse that can surprise anyone, with or without diabetes, when insulin levels fluctuate or your body throws a curveball. Feeling a little off isn't the only thing going on here. It's more like a secret clock that is running out of time for a major medical emergency. Today, we're revealing the important warning indicators that you must unquestionably identify before it's too late. The unseen threat. Understanding low insulin's impact. The hormone insulin, produced by your pancreas, serves as the best doorman for your body's cells. It contains the key that enables glucose, your main food-based energy source, to enter those cells and give you energy. However, what would happen if the key broke or the doorman didn't show up? Locking out glucose prevents it from adequately powering your cells. The opposite of high blood sugar, which receives a lot of attention, is hypoglycemia, which occurs when this system causes a sharp, dangerous drop in blood sugar. When your blood sugar falls below 70 mg per deciliter, you are officially diagnosed with hypoglycemia. What makes a blood sugar crash so concerning, then? Consider your brain to be the mission control center of your body. In order for it to work, it needs a steady supply of glucose. The consequences can be severe and intensify at a terrifying rate if that fuel line is cut off, even for a short time. Imagine mission control lights flickering, which can cause confusion, blurred vision, seizures, blackouts, and, in the worst cases, death. The important thing to remember is that people with diabetes aren't the only ones who should be concerned about this. Even though they are unquestionably more susceptible, almost anyone can become in this dangerous state due to factors like certain medications, serious illnesses, hormonal changes, or even extended fasting. The really sneaky bit? It is very deceptive and frequently sneaks up on you. Recognizing the red flags. Symptoms you can't ignore. How might we identify this subtle danger before it leads to disruption? Normally, your body will send out SOS signals. It's critical to recognize these symptoms because they can strike suddenly. Mild or early symptoms could resemble unsteadiness, or a jittery sensation may be experienced. Sweating, possibly accompanied by clammy skin or chills. An abrupt, strong hunger or even nausea may be experienced. An irregular or rapid heartbeat may also be experienced. You may experience extreme exhaustion and weakness, along with headaches or lightheadedness. Additionally, you may notice that your skin appears pale. It's as if the brain's communication channels are becoming sluggish and beginning to malfunction if things get worse and blood sugar levels keep falling. These more unsettling neuroglycopenic symptoms may be observed by you. You may notice abrupt mood swings or experience feelings of agitation or nervousness. Disorientation, difficulty focusing, or strange behavior, such as difficulty performing basic daily tasks. You may experience double vision, blurred vision, or even tunnel vision. Slurred speech or a loss of coordination can cause unsteadiness. You may experience numbness or tingling in your cheek, tongue, or lips. Your body is essentially raising a 5-alarm fire when hypoglycemia reaches a severe level. These are clear indicators of an emergency. Walking becomes difficult. Fits. Passing out or losing consciousness. The worst scenario is a coma. It's critical to understand that these severe symptoms are a warning sign. The brain is in serious danger, and prompt medical attention is imperative. Who is at risk and why, beyond diabetes? Now, it's widely accepted that hypoglycemia primarily affects diabetics, particularly those taking insulin or certain oral medications, and they do experience it most frequently. But the idea that they are the only ones at risk is a dangerous one. It's like walking a tightrope for someone with diabetes. Too much insulin, skipping meals after taking medication, exercising vigorously without making dietary changes, or drinking alcohol can quickly cause their blood sugar levels to plummet. However, what about people without diabetes? Even though it happens less frequently, hypoglycemia can still cause a systemic breakdown for a number of reasons. Drugs. Low blood sugar can be brought on by several medications, such as some antibiotics, quinine, for malaria, or if someone unintentionally takes someone else's diabetes medication. Critical illnesses. The body's capacity to regulate glucose can be hampered by severe diseases that impact the kidneys, heart, or liver, such as cirrhosis or hepatitis. Another possible cause is sepsis, a serious infection. Hormonal deficiencies. Hypoglycemia can result from issues with the pituitary or adrenal glands, which produce hormones necessary for glucose regulation. Overproduction of insulin. In rare cases, an insulinoma, a type of pancreatic tumor, produces excessive amounts of insulin by acting like a rogue factory. Other non-islet cell tumors can also occasionally open this insulin floodgate. Extended fasting or malnutrition. Conditions like anorexia nervosa or prolonged fasting can deplete your glucose reserves. Excessive alcohol consumption. Consuming excessive alcohol, particularly during fasting, inhibits your liver's ability to release its essential glucose supply into your blood. The important lesson here is that, although the odds are different, people without diabetes are not the only ones who can experience a dangerous blood sugar crash. Knowing these risk factors empowers everyone to be more vigilant. Taking control. Immediate action and prevention. If you suspect hypoglycemia in yourself or someone else, it's crucial to act quickly. If the patient is conscious and able to swallow, they may experience mild to moderate symptoms. Encourage them to eat 15 to 20 grams of fast-acting carbohydrates. This is comparable to quickly injecting high-octane fuel into a car. Consider 4 ounces, half a cup, of fruit juice or regular, not diet, soda, a tablespoon of sugar or honey, some hard candies, or glucose tablets. Give it 15 minutes. Then, if a blood sugar meter is available, take another reading. If the symptoms have not subsided or if their blood sugar level is still below 70 mg per deciliter, repeat the carbohydrate step. If their next meal is more than an hour away, they should eat a small snack or meal that contains some protein and carbohydrates once their blood sugar levels have returned to normal. This lessens the chance that it will fall again. It is imperative, however, that you do not try to force food or drink if you are experiencing a severe hypoglycemic episode, which is characterized by confusion and an inability to self-treat, unconsciousness, seizures, or difficulty swallowing. This is a medical emergency for DEFCON 1. If you have access to glucagon in the form of an injection or nasal spray and have received training in its use, administer it immediately. Consider glucagon as the emergency lever that tells the liver to release its stored glucose. The key to prevention is understanding your unique risk profile. If you have diabetes, this entails careful monitoring of your blood sugar, regular meal plans, and making sure your medication is in perfect harmony with your diet and physical activity, like a well-balanced orchestra. The goal is to identify and treat the underlying cause of hypoglycemia in people without diabetes. Additionally, keeping a fast-acting carbohydrate source on hand is like keeping your blood sugar first aid kit on hand if you know your risk. This knowledge could literally save a life. Please give this video a thumbs up if you found it useful. It truly helps us reach more people who are in dire need of this information. Click the notification bell and subscribe to the channel to ensure you don't miss out on more crucial health insights that could protect you and your loved ones. The most important action you can take is to share this video. Tell your friends, family, and coworkers about it. Sharing this information could actually change someone's life. In conclusion, dangerously low insulin levels cause hypoglycemia, a powerful enemy. It can ambush anyone under certain circumstances, so it's not just a threat to people with diabetes. The initial symptoms might be subtle, yet they can swiftly escalate into a loud commotion. You can genuinely save lives by identifying the warning signs, such as jitters, mental fog, and a racing pulse, and knowing the best course of action, whether it's the 15-15 rule or, in extreme situations, an urgent call for emergency services. Now you know how to recognize these dangerous signs. Don't ignore them. Remain alert, be prepared, and take decisive action. Understanding the effects of low insulin is crucial for protecting lives, not just for treating a medical condition. Continue to learn and be alert. It is important to seek emergency medical attention immediately if there is any possibility of severe hypoglycemia.